Good afternoon and welcome to a special Under the Wire. As you're aware, Under the Wire normally comes to you on Saturday morning, but there have been a few developments that I felt really important to share with you. So thank you for joining me on this special Under the Wire, and I hope that you will also share this broadcast with your friends and acquaintances and on your own Facebook and other social media pages. My name is Meryl Dory, and I'm the founder of the Australian Vaccination Network and the mother of a vaccine injured child. And I'm coming to you to talk to you about some new developments in the COVID 19 saga. Um, just when you thought nothing else could surprise you, things surprise you. Yesterday, Annastacia Palaszczuk, the Premier of Queensland, announced that the emergency declaration that was expiring yesterday was going to be extended until the 17th of August. So, nearly 3 months of an extension of an emergency that allows her government, and her police force just about total control over everything that you in Queensland do. So, thank you, David. It's good to see you from South Australia. South Australia is joining the fascist countries of Australia, having just passed during a time when nobody could actually even get to Parliament. No jab, no play legislation. They were one of the few holdout states, and they passed that during the coronavirus scamdemic. So Queensland has basically joined uh, the group of fascist nations and states by saying that they are going to extend the lockdown, the closed borders, all of that until the 17th of August. And it's because of coronavirus, which they are telling us is an emergency and that people are dying left, right, and center from it. And that's why they're doing this. The COVID 19 death rate without a vaccine is lower than the influenza death rate with a vaccine. Think about that for a minute. So, even though at this point in time we have no vaccine for COVID 19, we've shut down the entire country, we've shut down the world, basically. There are some countries that have not shut down and they don't seem to be having any problems with COVID 19 any more than they would have with influenza. But the death rate from influenza is actually higher, much higher, far higher than the death rate from COVID 19. Now, this is the latest information as of yesterday for COVID 19 for Australia. There were a total of 7,068 cases across the whole country, and yesterday, for the first time, we hit 100 deaths from coronavirus. Um, During last year's flu season, there were over 800 deaths and tens of thousands of cases. Yes, Connie, exactly right. It is not, if you think this is about coronavirus, you are so wrong. This is about control, and we are being played. It's about how far can the government push us towards total control before we do something. Yes, David is right. No government has shut down the nation or the economy for the flu. And we've had flu seasons that make what's happening right now look like nothing, nothing at all. So we have 100 deaths Australia wide, 7,068 cases, 11 of which were in severe condition, and the country's closed down. Businesses have gone bankrupt. Rates of suicide and domestic abuse, domestic violence have gone through the roof. These are the figures from Queensland. There was one new confirmed case. You're reading that right. One. 12 people in the entire state had been diagnosed with coronavirus and were still considered active cases. 1,058 cases had been diagnosed, 1,040 cases recovered. In the entire state of Queensland, there have been 6 deaths from coronavirus. Let's put that into perspective. Every single week in in Australia, at least 100 people are dying because of medical error or adverse reactions to properly prescribed drugs. But we don't have the government saying social distance from your medical doctors, do we? No. But they're telling us we need to go into lockdown because of this. Now, this is Queensland also. I have links to all of this information at the top of this Under the Wire. These are the cases per day and the deaths per day in Queensland since the outbreak, and I hate to even call it that because it's not really an outbreak, since coronavirus was declared an emergency. Um, Around late February, early March was when they started seeing cases, and by about the 30th of March, that those case numbers started to decline and deaths were a little bit later, which you'd expect. You'd expect to see cases increasing first and then people dying as they got coronavirus. But again, remember, we're talking about 6 deaths in the entire state. So again, there has been no increase in deaths. There has been a steady and constant decline in cases for a month. So, what is the reason behind Annastacia declaring that Queensland was going to remain on lockdown for another 3 months? Why is that happening? And why indeed? That's a really good question. Sorry, let me just go to the next page here. Okay, this is a page from last year, and what it says, flu experts predict 4,000 Australians will die from influenza this year. That's what they said last year at around this time of year, just at the beginning of the so called flu season. They predicted that there were going to be many, many thousands, 40,000 cases of flu had been confirmed at that point, and they were predicting that 4,000 Australians would die. Like most predictions from the medical community, they were completely wrong. There were about 800 deaths from influenza, but not all of those deaths were actually from influenza. Only a small percentage were actually from influenza. Most of those people died from pneumonia, and they may or may not have had influenza along with the pneumonia, and influenza may or may not have been causally linked. So we have the media, the medical community, and the government working together to blow up this incredible panic over coronavirus. When 100 Australians have died from coronavirus since the outbreak started, and 800 Australians died last year, ostensibly from influenza. Yes, Dee Dee, Queensland is a huge state, absolutely huge, but this regulation goes across the state. There are exceptions for the people who live in the outback, I guess because the people are more spread out there. Um, so yeah, but the whole state is being basically put in prison. You have done nothing wrong, and yet you are being put in jail. Every Australian must be informed. Exactly, Christine, they must be. So, what is the panic? What is the reason for all of this? I recommend that everybody visit this page. This was the page that the Chief Health Officer, Dr. Jeanette Young, who we spoke about in detail last week, the person who was responsible for covering up the death of Ashley Jada Papra in the 2009 so called swine flu epidemic. This page contains all the most up to date information on what's happening with COVID 19. And along the left here, you can see that there are lots and lots of different links. So when you have time, hopefully sooner rather than later, you will go through here. Um, what I've highlighted is this one section on non essential business. You see, according to the government, some of us are essential and some of us are really not that important. So it is so interesting to look through what the government considers to be essential and what's not. Cafes, restaurants, and fast food outlets and food courts are essential, but you can only have up to 10 patrons at a time. Now, in a hole in the wall cafe, that might be acceptable, but most restaurants might hold, I mean, there are some large restaurants that hold hundreds of people. So they're making a blanket statement no more than 10 people in a restaurant at a time, unless you're in the outback, and in that case, you can have 20 people. You can drink alcohol in a restaurant at a table as long as only 10 people are in the restaurant, but you can't sit at the bar and have alcohol because everybody knows that bars are infected with coronavirus and you cannot drink at a bar safely. You can have an auction with 10 people. Won't that be fun? Do I have any bids? Um, Real estate auctions, also 10 people. Anyone who puts their house up for auction at this point in time, I think needs their head examined. You can have outdoor and indoor markets, but if it's indoor, no more than 10 people. Again, hairdressers can have one person at a time. Oh, well, sorry, no, my apologies. One person per 4 square meters. And while so many other places are closed, you will be happy to know that pubs can stay open as long as, again, you're sitting at a table to drink, not at the bar, and you can have food there. Drive-ins, you can go to a drive-in, but only with someone who is a member of your household. No taking friends to the drive-in because your friends, whether you know it or not, are just absolutely bathed in coronavirus. Casinos or gaming venues can be open because they are essential, absolutely essential, as are strip clubs, brothels, sex on premises venues, because you can't catch anything while having sex with a stranger, and sole operator sex workers. These are all still open without any problem whatsoever. For example, video streaming or phone chat services. I mean, they have to tell us that we can allow video streaming and phone chats. Um, you have to read through this list because it is incredibly funny and also incredibly sad. What the government considers essential, what they don't consider essential, and the fact that we are allowing them to tell us what we can and cannot do with our own bodies, with our own time, in our own country. Um, Dee Dee said, "What is so sad is that so many people are not awake to these lies. And that's why we need to share this. Share it publicly on your timelines, share it on Twitter, share it on, I don't know if you can share it on Instagram. You might be able to, I'm not sure. Share it on every social media outlet you can, because the only way that anybody is going to get this information is if someone shares it with them. And honestly, people need to know that they have been lied to. Seriously, seriously lied to. Meanwhile, politicians are moving about freely, not losing money. Life is normal. It's criminal. Not only are they not losing money, they're being paid to do nothing. They're not in parliament. These rules have been passed without any discussion, without any vote in parliament. They have just been passed. We have no even attempt to think that this is a democracy when the government can do things like this. That said, I have to let you know, I spoke with a journalist. I don't know how many of you saw Alona's Facebook Live. Alona Lon, she's the IMOP, one of the IMOP candidates for Queensland. And she did a Facebook Live yesterday because she spoke with a journalist who works for the Sydney Morning Herald and The Age. And I had spoken with him a day before. And he told that she did a brilliant Facebook Live yesterday. If you're not following her page yet, please do. Alona Lon, Lahn. Um, what he told both of us with incredible confusion, I think he was very confused, is that um, the politicians in Canberra are getting hundreds and hundreds of letters from their constituents. For those who didn't see my interview with Melissa Bruce a few years ago, she has provided letters that you can send to your politicians, letters of demand and letters about compulsory vaccination. And politicians are just being flooded with these letters. And a few of them have said, oh, we're not even going to open them. And the letters are basically saying, I elected you and I want you to represent me. And what this journalist said was that the politicians can't understand why so many people are doing this at a time of coronavirus. They basically expected the entire country to be kowtowing and saying, "Oh, please, please, Canberra, keep us safe. Please keep us safe. In the Bundestag there in Canberra, make sure that we're safe." And instead of that, people are saying, "You are taking our rights away and we're not standing for it. We do not consent to you doing this." Um, and it was wonderful to see that so many hundreds of people have been out there flooding the politicians' offices, and don't think that's not going to have an effect. Even if they don't give you the response that you're looking for, the fact that those letters are going in, those hard copy letters, each one of those represents about 100 votes. So these politicians are looking at uh, a really big backlash against what they're doing, and it's good. If you haven't yet sent your letters in, please do that. I will put the link to Melissa um, Bruce's website in the comments here for those of you who would like to access that. I've just done it. So anyway, back to this. So this is the information from Queensland on what is essential and also all of the information on the extended lockdown. Now, New South Wales has taken a little bit of a different tack. New South Wales was locked down just like Queensland was, and their borders were not closed to Queensland. Queensland, the borders are still closed. You can't come in from other states without written permission. But New South Wales did allow travel interstate. From June 1st, which is 10 days from now, if you are a New South Wales resident, you can visit anywhere in regional New South Wales for recreational or holiday purposes. Caravan parks are opening, camping grounds are opening, national parks should be opening. They're still asking you to keep social distance, and the public health advisory is still in its place, but it says you can now travel to New South Wales from out of state for a holiday, but when you go back to your home state, you'll have to obey the rules that are there. So that's a bit opening up. It's still kind of crazy. And again, New South Wales has put together a list of things that are allowed by our lords and master in the government. Up to 10 people allowed to gather outdoors. Cafes and restaurants can seat 10 people at one time. Households can have 5 visitors at any one time. So the people that you allow in your house, the government is actually telling you how many you can have. Weddings can have up to 10 guests at one time. Save a lot of money. Indoor funerals can have up to 20 mourners. Outdoor funerals up to 30. What are they going to do? Arrest the corpse? I mean, I just don't know. Religious gatherings and places of worship can have up to 10 worshipers. Wonder what God thinks about that. Outdoor equipment can be used with caution. Sorry, I don't mean to laugh, but it is kind of funny. And outdoor pools can open with restriction. Now, can chlorine kill COVID-19? Probably. So um, you just have to wonder what the heck the people in Canberra and Brisbane and Sydney are actually thinking when they put things like this together, or are they thinking at all? It's very possible they're not. I don't know. What do you guys think? Are they actually using their gray matter? Yeah. What caution do you need to play on a swing? I guess not to allow it to go over the top. That's caution. And that pre-existed coronavirus. And do we really need the government to tell us what we as intelligent adults can and cannot do? Especially a government that can't balance a budget, can't make trains run on time, can't make roads safe, and yet somehow they're going to be smart enough to tell us what we can and can't do in the case of an epidemic that is milder than influenza on a normal year. I don't trust them. Do you trust the government? Hashtag, do you trust the government? No, I don't. So let me just take a look at some of these comments. Robert Kirk says it's like everyone is so dumbstruck from the fear they don't see the big picture and the lunacy of all this. Exactly. Exactly right. And Richard said this is just a test to see how far they can push us till we crack and find who are up against them. Remember, when they pass their final laws, every one of us will be expected to obey them. And that I'm so glad you said that, Richard, because that is why I put on this Under the Wire today. There was an article that was in the Age about a meeting that was held at the press gallery, a press club, sorry, press club. And the person who was speaking is someone by the name of Jane Halton. I don't know if I'm pronouncing her name right, but Jane Halton has worked for the government in the Department of Health and also Department of Finance. And she's recently been elected as chair of the Global Coalition for Epidemic Preparedness and Innovation, or CEPI. Now, I don't know how many of you follow the amazing Polly. I only recently found her, maybe a month or 6 weeks ago. She is amazing. She does incredible research into these organizations, World Health Organization, CEPI, Bill and Melinda Gates Foundation, all of this. And I only just recently heard about CEPI in her last talk because CEPI is a conglomerate, or whatever you want to call it. I don't know. Um, it's a coalition that is comprised of and funded by, hang on a second, I'll just get down the page so you can see it. Oh, here we go. Maybe it's not on this page. Here we go. Investors and Partners was founded in Davos by the governments of Norway and India, the Bill and Melinda Gates Foundation, the Wellcome Trust. Just to let you know, the Wellcome Trust, or Wellcome PLC, is a drug company, and the World Economic Forum, which is, these are all front groups that are composed of the same people who run the World Health Organization, the World Bank, the Bill and Melinda Gates Foundation, and the United Nations. This is the most incestuous type of, sorry, are you guys even able to see this? I think I forgot to share my screen again. I keep doing that. Sorry, here we go. So you can read it here. And again, I've got a link to this. This is the most incestuous type of organization, because you as an individual looking at this will think, oh, this is wonderful. This is all about being prepared for epidemics and how to save lives. And isn't that great? But it's not. It is how to make money by making people afraid and making them do what you want them to do, either by scaring them into it or by legislating them into it, which is basically what Australia wants to do. Now, this woman, Jane Halton, she gave a talk. Let me just go back here, and she's been made the chair of this organization, CEPI, and the Bill and Melinda Gates Foundation. I want you to know that Bill Gates has been making money hand over fist since the coronavirus epidemic started. He has, it is estimated, I think it was estimated that his personal wealth increased by over $100 billion, or that may have been the Bill and Melinda Gates Foundation. I may have the wrong figure. But he is making money while all of us are losing money, while we're seeing our 401ks and um, our superannuation and our jobs go down the tubes, while we're seeing our businesses go bankrupt. Um, People like Bill Gates is laughing all the way to the bank. And CEPI is a recipient of a lot of money from the Bill and Melinda Gates Foundation. He's considered a philanthropist. He's not, he's an investor. And I shared an article about him the other day where it says that investing in health, in worldwide health, was the smartest investment he's ever made, because he put a $10 billion investment in and he gained, I don't remember if it was $100 billion from that investment. So he's not a nice guy. He's not giving money to this to help people and save the whales and all this stuff. He is investing money in a strategic way so that he can reap the benefit of it. And from everything I've seen, the Bill and Melinda Gates Foundation has been responsible for the deaths and permanent disablement of millions of children around the world. So let's get back to this woman, Halton, Jane Halton. This was the article that came out in The Age yesterday. Top advisor to Scott Morrison backs no jab, no play for all. I love that they call it no jab, no play. First of all, that phrase was coined by the Murdoch media, and no jab, no play has to do with childcare and preschool. So it shows you that the government basically thinks of us as children, and there are parents who can tell us what to do and do anything they want with us. So you have no choice as far as the government is concerned. No jab, you don't get to play. No recess time for you. Um, One of Scott Morrison's key advisors on coronavirus has endorsed a no jab, no play policy for adults during the pandemic and encouraged during the pandemic. Now, the pandemic, for all intents and purposes, is over. So, what is she actually talking about? And encouraged the government to take similar action if Australians refuse any COVID 19 vaccine. So, this experimental vaccine that hasn't even been released yet, and one of the studies that has been done in Europe, they say that 20% of those who took the high dose vaccine had serious side effects. So, even with the serious side effects, too bad, sucker, you're going to have to take it, according to Jane Halton. Uh, she calls people who question vaccine nationalism. So, she is now associating people who question vaccine with the Nazis when really and truly it's the other way around. The government has got a couple of tried and true mechanisms in terms of people who are not happy to be vaccinated. We talked about childcare. We've seen a couple of pretty prominent cases in the footballing world just at the moment. Forget no jab, no play for kids. It's now no jab, no play for adults. And I would support that. Well, good on you, sweetheart. Um, there are some people, for a variety of health related reasons, they cannot be vaccinated. Now, we know that the only adverse reaction that the government will accept as a reason for a medical exemption is an anaphylactic or life threatening allergic reaction. So you get seizures, you develop autoimmunity, you develop any other condition after vaccines, too bad, you have to keep getting shot. Um, Yeah, she said that her support for no jab, no play was limited to what actions had been taken. That doesn't really make any sense. She said she did not want to speculate on future government policy responses and what they would look like. However, she added, I would encourage government to continue to take these sorts of decisions. Now, they haven't taken that decision yet, but I think she really wants them to. And can I just say here and now, the term that I really object to in this space is people who say that they conscientiously object to vaccination. Actually, unless you've got a good health reason, you're a vaccine refuser. Well, I think anyone who says no to vaccines has a very good health reason for doing so. So, whether you want to call us a conscientious objector, a vaccine refuser, or an intelligent adult able to make their own informed choice about what goes into their bodies, it doesn't matter to us what you call us as long as we have the choice. If a coronavirus vaccine became available, which was a reasonable chance, 17 years ago we didn't get a vaccine for SARS because they couldn't make one safe enough. So I don't know why she says that there's a reasonable chance. Ms. Halton predicted that there would be a stampede in Australia to get immunized. Well, if there is going to be a stampede, why do they need to make it compulsory? Why do they need this no jab, no play, which is basically what she's talking about is no jab, no job. If you don't take the coronavirus vaccine, you don't get a job. And not only do you not get a job, but you don't get to go out of your house, you don't get to mix with other people, and you don't get to do anything. So let me just see if there's anything else here. CEPI, which is the organization she's working with, is supporting 10 vaccine candidates, with one that could be trialed on humans as early as July. Because they've skipped the entire animal studies part of testing vaccines, and they're going straight to humans. If we have vaccine nationalism and one country looks after itself first at the expense of the rest of the world, everyone is going to suffer. Again, how does she get this? If the vaccine works and you take the vaccine, how is anybody else going to suffer? Um, as soon as there is a vaccine, I fear that we will maybe not be quite all in it together as we have been. So it's one for all and all for one when it comes to vaccination. There's always a pocket of people that are against vaccinations. What I found, though, in these sorts of circumstances where there has been death and severe illness, People are much more attuned to getting the vaccine than previously. See, they love to use that fear. Let's beat up the number of people who have this. Let's beat up the number of people who died from it. And then people will be willing to take the vaccine. We've noticed, for example, almost double the number of flu vaccines have been delivered and injected already this year compared with last year. Well, do you think that that might be because people have been told they can't keep their jobs unless they get a flu vaccine, or they can't visit their relatives in aged care unless they get a flu vaccine? Could that possibly account with that for that increase in the number of vaccines that have been administered? I don't know. Um, Yep, get the jab first, bad reaction, and then have it again. Exactly, Deborah. Because the reactions are not going to be usable as a reason to get an exemption, because the exemptions are only available for people who have uh, an anaphylactic reaction, and that's it. So we have a wait for a vaccine. How long is the wait going to be? Not long at all. This is the CSIRO. Preclinical COVID 19 vaccine trial begins at CSIRO, and it's actually tomorrow, oh no, sorry, next week, that they're going to be starting with their volunteers to administer this vaccine. Um, Vaccines generally take 10 to 15 years to develop and test, but when we have an emergency, that goes out the window. And the vaccine is going to be licensed probably by September or October. And I'm sure it'll be perfectly safe. Perfectly safe. And I think that this Jane Halton should be the first one to get the vaccine. In fact, she should be enrolled in the preclinical trials, as should Scott Morrison, as should Greg Hunt. Let them put their money and their health where their mouth is. Um, Yes, everyone needs to go to the site called Know Your Rights. That's a good thing to do because if you don't know your rights, you can't actually protect yourself. And David, yes, all of them have vested interests. Everybody who is pushing vaccines right now has the ability to make money out of the vaccine. And that should never, never be allowed. So, yep. Vaccines are not fussy. Who gets a bad reaction? Exactly. They don't care. Vaccines don't care. And then again, according to everything I can see, neither does the government or the medical authorities. I'm not talking about the doctor, I'm talking about the AMA. The idea is to get as many people as vaccinated, no matter the cost in health or finances. And speaking of finances, did you see that the Australian government is donating 350 million of our hard earned tax dollars towards the vaccine candidates that are being worked on right now? It is basically a telethon for the richest industry in the entire world, the drug companies. They make trillions of dollars, and Australia is giving them $350 million. Hi, Leah. I do want to point out, Leah just said she missed her notification. Um, there is a notification button on all of Under the Wires. It says get notified, but Facebook is suppressing that notification. The notification is sent out by Ecamm Live, but Facebook suppresses the notification so you won't get it. So when you find out that Under the Wire is going to be on, you probably need to set an alarm on your phone or something. I'm sorry. Every other person who uses this software who's not talking about vaccination gets the notification sent out. I do not. So I'm sorry you missed it, Leah, but you can watch it afterwards from the beginning. So yeah, Deborah, you too, huh? I'm so sorry about that. Just make a note that in future, put some kind of reminder down because that's the only way you're going to get notified. Um, yeah, people are still struggling post bushfires. That's true. Climate change has been put on the back burner. Now we have drug companies trying to outdo each other and roll out the first COVID vaccine. Why do you think that is? Because this is going to be one of the most lucrative vaccine markets ever. Most vaccines are only given to children or to limited numbers of people, like the HPV vaccine when it first came out was only given out to girls. Now it's girls and boys, and then they're expanding the age group. But when the COVID-19 vaccine comes out, it's going to be given around the world, 7 billion people or whatever the world's population is now, every single man, woman, and child. And it is it is money in the bank. It is guaranteed income for these drug companies. And not only is it guaranteed income in the United States and probably in Australia, because Australia does this when there is an epidemic or an emergency situation, they indemnify the drug companies so that you can't sue them even if you get injured. So it's why wouldn't they want to be the chosen one for making this vaccine in Australia and in the United States and in Europe? Um, and yes, Robert, you're right. Flu vax is yearly, so it's even better if they can get more people on it. And that's the thing with COVID-19, it's going to be another annual vaccine because since they first identified COVID in December of 2019, and I think it was December of 2019 they identified it, it has mutated at least 8 times. So every single year, just like influenza, they're going to have to take a best guess on what vaccine strain will be required and use that one. And every year it's going to be a new vaccine. We are voodoo dolls. We are going to be pincushions with vaccines sticking out of every single part of our bodies. Um, so yeah, Bernadette says, I have not vaccinated my 3 boys and I am not going to start now on a rushed vaccine. This is insane. The thing that is the most insane about this, as far as I'm concerned, is the fact that so many Australians will take this vaccine, that they will actually agree to be vaccinated. And that's the really scary thing. Yes, here's the article. I knew it was next week. The first Australian COVID-19 vaccine trials are ready to begin. Queensland volunteers will be among the first in the nation to be dosed with an experimental coronavirus vaccine when clinical trials begin next week. Bully for them. Um, you have to wonder, what have they told these people that they're willing to volunteer for this sort of mad science? Especially when 20% of the people who got that vaccine in Europe, and they were only testing it on 45 people, and based on the results in 45 people, they're going to license. And there were 3 trials, 15, 15, and 15, and one of the trials got a higher dosage of the vaccine, and 20% of that trial group had serious reactions. I don't know what the the number of people who got the lower doses who had serious reactions were. But in order to license a vaccine and make sure it's safe, you're going to need to test it for a long period of time in thousands or tens of thousands of people. And that is not being done at all. The people who are getting the test vaccine are all that's going to be tested on before it's released to market. And when it's released to market, my estimate, my guess is, having seen these sorts of things before, that there will be thousands of serious reactions and possibly deaths. And those will either be called coincidences or reactions and deaths from COVID-19. You had a pre existing infection with COVID-19, and sorry, the vaccine wasn't given to you on time. Um, Let me just take a look and see some of these comments. Here we go, here we go, here we go. Sorry. Yep. Also inducing people to be 100% dependent on the government. The joys of socialism. That's right. They're taking away our jobs. They're taking away our businesses, our industries, and they're saying, that's okay. We'll pay you to stay home and do this. And if you want to be paid to stay home and do this, you're going to have to do whatever we say. We are making you totally dependent. You can no longer make your own choices. Even if the politicians get a vax, they wouldn't be receiving the same as the population. That Vita, that actually happened in Germany. Yeah, it was Germany during the swine flu campaign in 2009. Politicians and public figures were given a different flu vaccine than the rest of the population were, and this didn't come out until later on. And yet, people still trust vaccines. They still trust their politicians. I don't. Peggy, people are insane to agree to that vaccine. I could not agree with you more. Um, Oh, thank you, Connie. That's lovely of you to say. Thank you. Um, yeah, Monique, they may very well die. I'm not sure what the question was, so I'm sorry. Very scary that so many are blinded by fear that they will accept a mythical vaccine, uh, one that is not even tested in an animal study first. And yes, that's true. And Leah said, my mom called me because she had a thermometer pointed at her head without her consent. Her dentist refused to see her. It's crazy, absolutely crazy. I've heard that in Queensland and New South Wales, I don't know about other states, but if you go to a restaurant, you are either required to scan, and I talked about this on the weekend because New Zealand started this. You are either required to scan your phone, scan a code, like one of those QR codes, with your phone, or you need to put down your name and address and phone number on a register at the counter. The restaurant's required to ask that. If they don't ask that, then they can be fined. And I spoke with someone who went to a restaurant last night, and they said there were any number of Brad Pitts eating there and Adolf Hitlers. And so the thing is, people are putting down fake names, and I don't blame them. Good on them for doing that. Um, so let's talk about we've talked about the problem. Let's talk a little bit about potential solutions. Um, it's hard to know where to even start with this. At the AVN, we are being contacted. I'd say that we're getting maybe 50 requests a day, either on Facebook or email, maybe more than that, that we're answering. I'm not answering all of them, so I don't really know the exact number. From people who are either being told they're going to lose their jobs if they don't take a flu vaccine or who can't visit their elderly relatives. I got a heartbreaking one yesterday from a woman whose father is on hospice in an aged care facility, and they say he's only got days to live, and they're not letting her in to see him because she's not vaccinated against flu, and she won't be vaccinated against flu. Fair enough. And she asked what I thought she should do. And I said, I can only tell you what I would do in that situation. I can't tell you what to do. If I was in that situation and I only had days to spend with my father before he passed, I would be going to the aged care facility and walking in and seeing him. And if they tried to stop me, I'd be walking past them and saying, please call the police and ask the police to take me away. And when the police showed up, I would be sitting there with my phone and I would be telling the police while I live streamed to Facebook or wherever else that I was here to see my father who was dying. If they wanted to arrest me for seeing my father who was dying, then that was fine. But everybody in the world would know that I was being arrested. What is your name? What is your rank? What police station do you work at? Please say it loud enough that the camera can see you. We have got to stop being such wusses. And I don't want to insult anyone. Some of my best friends are wusses. But we have been warning, we meaning the AVN, have been warning you that this is coming for God knows how long. And I think people didn't believe it. And to be honest with you, I didn't 100% believe it. And I certainly never believed that it would be as fast as it has been. That the whole world could change in a matter of 3 months' time is just amazing to me. And I think even the people who perpetrated this crime on Australia and the rest of the world are amazed at how quickly and easily people rolled over and allowed this to happen. So it is time for us to stop accepting and consenting, because by allowing yourself to be kept out of aged care facilities, by allowing yourself to quit your job because you're not taking a flu vaccine, let them fire you. Let them fire you. Don't quit. Let them fire you. And then take a case for unfair dismissal. Um, I'm going to put a phone number down here and some information. This is Serene Tafaha, and I'm probably mispronouncing her last name, something chronic. And she is a solicitor. I've just shared her name and phone number and web address, I believe. She is in the process of putting together a class action um, for people who have been discriminated against as a result of this new emergency declaration and the requirement for flu vaccines. So don't complain. Don't sit there and moan and worry about this. Do something. It is time for all of us to do something because the government can't do to us what we don't allow them to do. I'm going to show you in the United States, they have the same sorts of restrictions that they have here. And states there have, some states have opened up. Georgia was the first state to open up, then Texas, and a few other states have opened up. And they've found that they've had absolutely no problem after opening up. But some states have continued the restrictions, and Virginia is one of them. Now, the United States is in the Northern Hemisphere. They're going into summer right now. As a matter of fact, this past weekend, I think, was Memorial Day weekend, or it could be next weekend, which is the official beginning of summer as far as going to the beach and all that goes. So in Virginia, the Democratic governor had said that people were not allowed to go to the beach and the beaches were roped off. Thousands of people who live in Virginia said, stuff you, and they went to the beach. And the governor said, forget about it. I will not have this restriction anymore. You can go to the beach because the people have the power as long as we exercise it. Now, in Australia, we have lots and lots of people who are very concerned about this subject. I just saw this morning and thought it was brilliant. It's not that well written, but it's pretty well put together. These flyers have been appearing everywhere in Cork, in Ireland. Q19, fascism, know the signs, and they list these things, and they've been appearing everywhere, and people have been reading them. The people on the news have been covering this. Where are they coming from? Who's behind it? It's making people talk about it. It's getting people thinking. So we can do things like this. We can make flyers and put them out. It may cost us $50, whatever. Get together with some friends and get some printed. Put some information together on a flyer and put it around. And you just never know how many people are going to be affected by this. I'm just going to share another screen here from Chrome. There are, on the 30th of this month, the 30th of May, there are rallies called the Millions March. These are actually global, but there are rallies in most capital cities in Australia. These are the ones I know about. Perth, and I have links to these at the top. Perth, they're all on the 30th. Did I say the 31st? The 30th of May. Perth, Sydney, Canberra, Melbourne, and Brisbane. Brisbane has its own page, which I will bring up here. Oops, hang on. I think I clicked the wrong thing. There we go. That's the Brisbane rally. And it's called the People's Revolution, Picnic for Our Rights, because picnics are allowed in Queensland. As long as you have no more than 10 people in a picnic, you can go to this rally. Now, I am talking to every single person who is watching this right now and lives within 2 to 3 hours of their capital city. You have got to go to these rallies. You have got to be there. Because remember what happened in Virginia when the governor said people could not go on the beach? The people went on the beach anyway. And the governor said, nothing I can do. There's too many people here. Go for your life, swim, have fun. That's what will happen if we get thousands of people at each one of these events. And we need thousands of people at each one of these events. There's no reason why we shouldn't get that, because everybody is being affected by this. Everybody. This stupid, nonsensical emergency. Everybody is being affected by it. Beatrice says, I believe that I am responsible for my health and I do not consent to be forced to accept any form of medical treatment because of other people's beliefs. I refuse to be infantilized by government policies that deprive people to have a choice. And I agree with you 100%, Beatrice. Absolutely. And Bernadette said, what can we do to help and unite so that this message and info is heard? You may not have been here at the beginning, Bernadette, but share this as widely as you can and come to the rally in your state. If you are close enough to go to your capital city, please go and let other people know about it. Just share this information and get out there. Yeah, Robert, under what law? Exactly. And that is why Serene is taking this case, this class action, because what the government is doing, as the government, they have certain rights. They can do certain things. They can make laws. What the government is doing right now, according to everything that I've been reading and according to many solicitors and barristers that I've spoken with, is not backed by legislation and it is unconstitutional. So we need to challenge them. We need to get out there and unite. So, yeah, contact Serene if you've been affected and just work with all these people who are out there trying to get things done. Send your letters in. Go to Melissa Bruce's page and send those letters in. Notice to cease and desist, forced vaccination. Okay, I don't know anything about that, Sam, but anything is worth trying. Time to unite and stand together. That's exactly right. For those of us who have not done that to now, it is time. Um, I would do the exact same thing. I would go visit my loved one in a hospital and I would not back down. And that's what we have to do. How dare they tell us that we can't go and visit our mothers, our fathers, the people that we care about and love, especially if they're on their deathbed? Nobody can tell us that. And nobody, it's horrendous to think about, nobody should have to die. It's bad enough to die in a hospital. I mean, nobody should have to die in a hospital if they have a family who can be with them. But if you are in a hospital, nobody should die alone. You're going to be alone a long time after you die. Nobody should have to be alone when they're dying. So, yeah, it's just crazy. So, when it comes down to it, there are lots of things that we can do, but we need to get over our fear. We need to get over our timidity and our feeling of, I can't do this, I'm powerless, because together we are incredibly powerful. And we need to take responsibility for what is happening now. David said ScoMo said that the federal government has no power in itself, that the power lies with the states. This is proof that the federal government does not have the power to do what it does. We need to target the state governments. And you're exactly right. The federal government declared the emergency, and based on the federal government's emergency declaration, the states then brought in these restrictions. Um, oh, good on you, Peggy. I'd love to see you in Brisbane. That's really good. Um, David said, I bet ScoMo and the other World Pied Pipers have been on full pay while millions have lost jobs and living. You know that. They have not taken a cut in pay. And in the United States, I think they actually voted themselves a pay rise. I could be wrong. I remember reading something about that. Yep. All acts of parliament are not the laws according to the Constitution, and that is true because they have not been given royal assent. And unless they've been given royal assent, they are not legal laws under our Constitution. So that is absolutely true, and that needs to be fought in court as well. There is no one to advocate for patients who are sick and vulnerable. And the death rate in aged care facilities has gone up like crazy since this started, be- partly because when you have a relative in aged care and you visit them, you bring them food, you might help bathe them, you talk to them and take care of them. The staff there are overworked. They can't possibly do all the things that you, as a loved one, can do. If you are not there to provide that, they are much more likely to die and die in terrible conditions. It's very sad. Kathy says there seem to be various letters to be sent, cease and desist, my will, and others across 4 units. Can anyone please clarify the difference? I honestly can't. I know that we at the AVN have been sharing Melissa Bruce's website with her letters there, but I know there are others, and I honestly don't know the differences. I think that we all need to research this and find out what we think works best and resonates best with us. Um, Leah, contact me. That would be good. Yes. Oh, no. No, contact me. I'll talk to you. Um, Uh, They did get a pay rise in Queensland. I didn't know that. Okay, that must have been the place that I heard. So, are you talking about the government, the people who work for the government? They got a pay rise during this. So, useless bureaucrats who've never done an honest day's work in their life, for the most case, are getting paid more money during this pandemic, while the people who actually produce and do the work of the nation, without whom this nation would not exist, many of them have been forced out of their businesses. They've spent lifetimes building up, or they've lost their jobs. It is shocking, and we've got to stop it. We've got to just let the government know we're not going to take this. We don't consent. People, stop making excuses about what other things you have planned on the 30th of May. I'm sick of hearing it. When your rights are gone, it will be too late then. So stand up now. Cheers, Kathy. Exactly, Kathy. And I love your profile image. Kathy was with a group of IMOP people. It's not involuntary. It's Informed Medical Options Party, and they got together and they protested by themselves about what's going on, and that's the way it needs to be. But on the 30th, we need thousands of people. No excuses. You have to be there. The only excuse is if you live more than 3 hours from a capital city. Other than that, no notes will be taken. I feel like your teacher. The one I linked to above appears to be the most comprehensive and legally sound, though I may be wrong. So check out Sam's link. I don't know. I haven't looked at that one, but there are a range of options. And again, as I said, do your due diligence and decide which one is best for you. Nurses and midwives asked for a 2.5% pay rise from July 1st. The government wants a pay freeze, unions fighting it. Can you imagine? Politicians are giving themselves a pay rise. Ugh. Yes, the politicians. Unbelievable, I know. Sadly, it's very believable. It's what politicians do is they steal our money and take it for themselves. They're like Robin Hood's, only reverse. They steal from the poor and give to themselves. Um, Came in late, but Robert Kennedy's interview with Polly has excellent information. Is that the amazing Polly? I haven't seen that one. And statistics, Ray, the new vaccines and the consequences of the lockdown. Thank you, Yvette. I appreciate that. And as always, I've gone way too long. um, but yeah, when I read that article in the Australian this morning about no jab, no play for adults, I knew that I had to get on here and tell you people all of this. 5 years down the track, we're going to look back on this time and think, how the heck were we ever fooled so easily? Because coronavirus is not the killer that we've been told it is. And the vaccine may very well be the killer that I personally think it's going to be. So, Polytomy, oh, okay. I have to look at that. Thank you very much. I haven't seen Polytomy. So, We Are Vaxxed. If you go to the We Are Vaxxed page, you should be able to find that, or they're Vaxxed on YouTube. So, once we get the bus on the road, the Vaxxed bus on the road, we'll be streaming to We Are Vaxxed as well when we do our interviews. So, that's wonderful. Everyone, I want to thank you all again. I'm hoping that all of you will share this as widely as you possibly can, and that every single one of you, your friends, your families, your acquaintances, people you just meet on the street, will be told about the rallies on May 30th in the capital cities, and that you will share the links to those too. I forgot to tell you, there was another page, a Facebook page for the Millions March, and it got taken down by Facebook yesterday. So when you go to that link that I've shared at the top of this broadcast, maybe save an image of the page so that you have it in case it gets taken down, and save the details of your state's event so that if it gets taken down, you still know where to go. Peggy, can you come on the bus and cook for us? Um, Sadly, at this point in time, we're not going to have the ability to take more people, but I do appreciate that. And when we're on the road, we will always appreciate gifts of food. We had that in the first Vax tour. People were giving us the most beautiful food wherever we stopped, and we appreciated that because otherwise we were eating at petrol stations and just those greasy spoon joints on the sides of the road. So yes, if anybody wants to provide food for us while we're on the bus, we'd appreciate it. But I don't think we're really going to have the ability to take more people than we've already got. We're going to have 4 people on the bus. So yeah, that's it. You deliver, you do takeaway. That's allowed right now. Thank you so much. And we will be going public with our schedule our of the first tour as soon as we know more about what the situation is with the legalities of the lockdown situation. So, on that note, thank you all so much, everyone, for coming. Uh, Please feel free to leave more comments or ask questions, and we will be happy to take a look and answer them as the day goes on. Okay, thanks so much for joining me on this special Under the Wire update, and I hope that you enjoy the rest of your day and your week until I see you on Saturday. Take care now. Bye bye.